Eyes. Hold up. Could you perhaps do an iris analysis of my eyes? I am a 20-year-old male, 5'7". I have some bone, let's say anomalies along my body. My rib cage is asymmetric, and so is some of my facial bones, including my nose. Both the septum and the bony base of the nose. Oh, really? Nothing too extreme. Also, I am very curious as to what glands can stunt height growth other than the pituitary. For example, could a weak parathyroid alone stunt growth even if the pituitary is in good health? That's a good question, Nick. You know what? I can't say. I could say that my guess would be to some extent. Because if you're not utilizing calcium, you hear this common problem in children that they call growing pains. You know, I mean, this is typical AMA crap. Growing pains. Well, growing pains is not natural. What's going on here? And then you find the parathyroid and low calcium utilization. You might be right on to that. Now let's take a look. This is your eyes. Let's take a look here at the young man, Nick. All right, this is Nick's right eye. Good picture, Nick. Good picture. Now, what color eye am I looking at? What color should it be? Blue. It's green-brown. When you see a hazel eye, that's a green-brown eye, or a green-orange eye. It's always, when someone says hazel, you know immediately there's going to be brown right around the pupil, or orange. Now, what would brown signify? And let's put it this way first. What tissues wrap around the iris? The GI tract. The stomach immediately around the pupil, and the small and large bowels wrap around the pupil. So, immediately, this young man is chronic in his GI tract. And yes, you have a chronic pituitary and pineal gland, my friend. Means I don't know how well you sleep. These are called radii solar. So we talked about this on the last video, I think. These black lines that go up, emanate up. Take a look at those black lines that emanate up. Now, I don't have any help to focus in on these. I apologize for that. This is Sunday here, and no one works on a Sunday but me. Now, I got some weakness in the frontal lobe with that. It's a transverse colon that's mainly involved here with weaknesses, but you have it all around the pupil. So you want to kind of work on that. I think it affects some of the right ear. You actually have it up toward the mastoid and medulla and cerebellum, which could give you some equilibrium issues, my friend. Knee, right knee, part of the femur is also involved there, appendix, groin, and hip as well. So that's sneaking up on you. You got to be careful. Now, you might have a little pancreatic boot here and a gallbladder boot. It wouldn't hurt you to clean out your liver and gallbladder a little bit. You got good genes, though. You got nerve rings, and you got a skin ring. And your eyes should be blue, so that shows you a lot of lymph. And you see your blue eyes through your nerve rings. So you're looking at your adrenal glands. They're not, if I say they're chronic, it's on the light side of chronic, but they are involved, and of course so is the autonomic nervous system now. So your family has been dealing with this weakness for a long time. Now you have autonomic nerve weakness, and it slices through the lungs and stuff. So I don't know if you had asthma when you were young, but this is what it can give you. Pretty much the same thing on your left side, bro. You've got pituitary involved here. When I get to the the parathyroid gland, there's a tad bit of that as well. So you kind of got both of these things addressing you. Not so much thyroid, but definitely you can count on parathyroid and pituitary. So I'd address those with glandulars, no question, because they're in the chronic side. You want to wake them up a little bit. Also gives you a little chronic bronchial trunk there, a little mid-back going on there. Maybe a tad bit of bladder as well, but where you pick it up, you got a weak left leg, but I pick it up at left groin, left hip, and maybe a little left testicle. But On top of that, you got good genes, man. You just got to get into those bowels and clean them up. Cut this feed to the head off. Get up here with upper circuit brain and nerve for a while. Enhance your nervous systems through your brain and nerve formulas, upper circulation, but also through the adrenal glands. You're going to have to work on your adrenal glands for a while. Kidneys, not too bad. You might be not filtering or something, because your eyes are definitely should be blue and they're green. And that's lymph. That's all lymph. But pretty good.